Okay, so in chapter 10, still,
Massage manipulations and techniques, part 4.
4. So we are going to look at the modifiers. So we've talked about the methods that ultimately are a push or a pull that create stressors into the tissues that change the shape or it moves it. That affects the nervous system, or in some instances the pliability, the jello-ish type component of the soft tissue itself. But now we can change it a lot of different ways with these modifiers. So what are there? 12.
I'm going to summarize the methods real quick, and then I'll just go right through all 12 modifiers, and then we'll go into each modifier.
All right.
So the methods that we did in part 3 are static method / holding, compression, gliding, torsion, shearing, elongation, oscillation, percussion, and movement.
Now you might hear terminology that's got a historic value
like
to
a
it.
Swedish massage.
Like, yeah, and that's kind of an approach. So you might hear gliding called effleurage, kneading called petrissage. It's kind of time to move beyond those things, unless you're embracing your approach to how you are doing massage to the classic. It's actually called classical massage. The classic, quote, Swedish system. Otherwise, it's better to move into these more descriptor, generic terms.
And that's what we need to realize, is that Swedish massage has more substance to it.
Oh, yes.
Just like any culture or philosophy does. The techniques, the methods, may predominantly happen to be gliding and kneading, called effleurage and petrissage. Shiatsu was another one.
That's a compression-based system.
And that's more of a rhythmic compression-based. So understand there's a difference between understanding the philosophy of a modality versus the methods that are used in that modality. We are teaching you the methods. To say you know how to do traditional shiatsu massage
just because it's a compression-based system
is not quite correct. Can you use methods that are used in shiatsu and have that dialogue with someone that's seeking that therapy? Yes. So it's kind of a classic scenario where somebody asks you, do you do shiatsu massage? But I know I have an awareness of some of the techniques, and I can help. I would hope with your guidance and your input that we can get a similar effect and sensation.
That's right.
But there's a cultural nuance, and it's a broader way of thinking. There's more to it than just the method.
The whole philosophy, the whole approach to assessment, that's what's embraced in these cultural systems. And just taking a 2-day class in something and saying you know how to do shiatsu or Swedish or Thai massage, that's really unethical.
And in a broader context of how we tend to approach this, it's one in which we believe, and it's really coming from her philosophy, in that teaching the methods it's like giving people the toolbox with the tools. If you individually have a passion for a certain modality or concept or philosophy, it behooves you to go and immerse yourself in that post-secondary.
Yes.
That's not quite right. But beyond beyond your entry-level education, which should be mostly about the methods, then go and specialize. But trying to do it all together, you're not really getting the meat of either one. If that makes any sense. So there's our methods. Now we're going to go into the modifiers for those methods.
Okay,
right?
so what's the first one?
So our modifiers, I'll list them out real quick. So pressure, point of application, magnitude, direction, drag, speed, pacing, rhythm, sequencing and transitioning, frequency, duration, and intention for outcome.
Now we actually covered all these in part 3.
No, at the part one we talked about
Yeah.
this. We've talked about it some, but if you want maybe a touch more dialogue, the introductory video and one we talked about some of that.
So
too.
let's start right from the beginning.
So right at pressure,
Light,
which could be just the hold,
or it can become deeper and deeper and deeper and deeper and deeper.
Mm-hmm.
That depends on tissue depth, and I'm going to use more force on you maybe than I would on your grandma.
Mm-hmm.
Okay.
So point of application, i.e. the location and broadness of contact.
So if I'm working on a fleshy area, I'm going to try to have a broader contact, and we've taught the forearm,
So the back, hip region,
the legs.
compared to, let's say, the neck of the arms.
And there I might have a narrower base and use the palm of my hand. Rarely, but once in a while, I might use a very narrow contact, which would be the tips of my braced fingers. The thumb does not stand up to
No.
pressure. I might use a tool.
Exactly. You could use a tool, but this whole idea of using the thumb, you're much better set, real quick, to just bring all your fingers together. These two middle fingers are braced between my pinky and my index, and then this hand also comes over. Now, usually I personally end up using maybe the middle finger and ring finger more. It's dispersed out amongst the other fingers, but I'm trying to support those as much as possible on either side, and then use the other hand to create that point. Saves my fingers. I get the same point of contact, but less stress on my body.
And you remember when we were talking about the video related to pressure delivery specifically, you can give the perception of more pressure, more depth. You're using your forearm first, but just by bending your elbow a little bit, it narrows that contact.
Narrows into that edge of the ulna there.
Yeah.
So, magnitude, i.e. intensity.
So the two things that change the experience of intensity and magnitude is how the pressure is applied and the drag, basically. And then also the third one on that is how active is the client. It's going to feel more intense or have more magnitude if the client participates. So using your arm, if I glide, that's going to have a sense of less intensity than if I use a narrower contact. Then if I have you also move, that's going to create more intensity. And then if I pin and then have you move through it, that adds another level of intensity.
Or even a she, so it can be, do I apply an application without movement?
Yes.
Do I apply it plus passive movement? Do I apply it plus active movement? That would be an example of going up in intensity, is that correct?
Yeah, and a lot of people think of the intensity as being how close to it hurting can you get. And that really, clients should not have to endure a massage to experience intensity.
Absolutely. The statement I usually make with a client is it should never feel like it's too little or too much. It should be just right.
Yes.
And just asking that question, especially during pressure delivery, tell me, client, when the pressure's just perfect. So, okay. Direction.
Oh, well.
Which direction do you go?
So if this is the back, this is the arm, I can go from distal to proximal, or I can go proximal to distal. I can go in a circle. I can go across the grain of a muscle. I can go with the grain of the muscle. I can go little, proximal to distals. So some of the modifications for fluid movement, for example, might have direction as a component. So that way you're thinking about what's the best way
to move that fluid.
Yeah, mimic normal and move that fluid.
So with lymph drain, maybe starting proximal and working your way distal plus joint movement. So your intention becomes a component in direction, as well as the anatomy
Yeah, and there's
and just ergonomics.
well, true, because I'm not going to drive myself nuts. There's the old think, oh, your strokes always have to go
Toward the torso.
toward the torso, and they have to go from superficial to deep. You know, all of those kinds of things that go on with that. And I want people to learn to maximize effort when applying pressure by leaning up a hill, which means I'm going in whatever direction the hill is.
And optimally, tissue should move in every plane.
Yes.
More in some planes than others, but you may find you can apply a method to a section of tissue better in one position versus another. So maybe I work on the calves in prone going proximal to distal because I have a hill
Yes.
with a bolster there. But if I turn them sideline, now it's going to be easier for me to work from distal to proximal.
Or
and
to
I
work.
just save that energy and time and maybe reposition the client.
Well, and also sometimes some theory of thought is you have to go from insertion to origin. Well, actually, that's old think, that terminology. It's one attachment to the other attachment. So you're going longitudinal, where you're going to get more of a force application if you go across it instead of from one end of it to the other. So that's all of that.
Now, drag becomes our next.
And we talked about that too, but drag is how much pull you have on the tissue. Stepping out here a little bit.
In practical context, from a practical context, it usually means how much lotion do you use.
And I like to demonstrate drag with a paper towel.
It's a great thing to be able to utilize in the classroom, by the way.
So I don't know if the camera's going to pick this
You
up.
can see the tension enough, but she's going to indicate that the ply between the, so she has two sections of paper towel, and she's looking at the little perforated
Right.
section in between and seeing how far can she pull it without it tearing.
That's right. And so you can pull with both hands or two forearms, but I think you have less control that way. So you pick out which hand is going to be the holding hand and which hand or arm is going to be the moving. And you hold it there, and then this is my moving hand. Now, people say, well, I can't feel it. They're feeling it in the wrong hand or under the wrong arm. So it's this hand, the holding hand or arm. When I move this tissue, which is going to be an elongation, drag involves some sort of a lifting or an elongation. As soon as I feel it in this hand, now I know I have reached the end of the typical excursion for that tissue layer right through there. And most people find it very satisfying with a level of intensity. If you work at, a
little too much.
I just destroyed my client. If you work at that edge.
Yes.
Sometimes they'll call that a therapeutic edge.
Should have that kind of good stretchy
pulley
sensation.
taffy.
Like it's getting deeper into the tissue. It can, if it's a touch more aggressive, it can approach a burny.
Yes.
But again, always from a positive therapeutic perspective.
Absolutely.
So, on to speed, which is relatively self-explanatory. How fast do you work?
And I am always telling our students, go slower.
Slow down. Far too often the perception is like you're tenderizing steak or trying to knead dough. You are going to maximize your effort and the comfort of the client by slowing down. Better to do 3 long duration methods versus 10 fast ones.
Absolutely.
And I personally have experienced that when a therapist works too fast, it's simply not very comfortable. So rather than trying to get many glides in an area, let yourself sink in and do a few good slow ones.
Fewer glides is better. And people get a time urgency. They think, oh no, I've only got 15 minutes left in the massage. I gotta speed up.
Right.
What you do is less strokes
Yes, so I might go to 2 glides.
instead of 3 or 4.
Exactly.
And
now there may be times when a faster movement is ideal. That would be
shaking,
the shearing effects, things like that. But typically during a massage, slow down.
And the deeper your perception going down into the tissue, the slower you need to go.
And that's a very good point. The more superficial you are, the more leeway you have. The deeper you are, the more pressure you're applying, the slower you should always be going. Now we're on to pacing.
Pacing is, we talked about that one. I think how much time do I have left? How much time am I going to spend on your arms versus your legs? The biggest issue where people have trouble with pacing is they spend too much time on the back.
In prone.
Yep, and in the prone position.
And in some of the demos, they're already out there. There's a lot of value with making sure you just save that time and energy. From a client satisfaction perspective, the number one issue we deal with is low back related dysfunction.
Yes, but I get that better when they're sidelined.
Yes. So work on it a little bit in prone, save some time, get them on their side. Even if sometimes I have to say to a first-time client, don't worry, we'll make sure we get that.
Yes.
Turn your side. I will have done the whole assessment process of getting them comfortable with the idea of sideline if they haven't experienced that yet. But better to hit that tissue from multiple angles, in multiple positions. You're going to actually access more of the tissue. And from just a satisfaction perspective, if I work on a little bit in prone, a little bit in sideline, and even a little bit in supine, maybe with a big pull and twist, now their low back, their area that they came in wanting addressed, has been worked on 3 times, not just once.
And pacing also has to do with, typically we've got an actual 50 minutes. And we need to say, okay, I've got 5 minutes here. And that should be part of your general protocol. And that should be practiced. That timing should be practiced. And in the textbook, there's an actual timed out. And you know what else is fun is to use music. And you have practiced with the music and you know, okay, when it gets to this part, I better be moving to another part of the body.
That's where the value starting out of using the same playlist. And there's plenty of them out there, believe me. You can look on YouTube, plenty of playlists that are exactly 50 minutes. And then yes, you know when you start to hear that part of the song that you should be at this place and in the session. Moving on to rhythm.
So there's rhythmic, which is mostly what we do. We have, we get that as we rock our own body back and forth. It comes pretty natural with the body mechanics we teach as I move from my back foot to my front and back. That slows me down. And it also gives me a nice rhythm. Rocking is a rhythm to it. Moving around the body in a reliable way. Clients, and we go back to the pacing, clients like that. They like to know kind of what's coming next. They like the routine.
And that the duration of the applications is about the same. The time of each glide is similar. But yes, clients will get conditioned to the therapist's routine.
And that doesn't mean that you're doing a cookie cutter massage.
No.
It just means that your approach to moving around the body. You and I
know,
both got
I know.
COVID hair.
Yeah. No haircuts during the pandemic.
Yes, no, so.
But
So what was that when we were talking? Rhythm.
So with rhythm as well, we just got them talking about music. Something
Yes.
that really helped me when I started. Thankfully, a lot of the relaxation-based music is right around 60 beats per minute. It's the ideal for our body does tend to sync up our heart rate what have you will sync up to to the pacing
Mhm.
and rhythm of the music, so you can let that guide you early on. You may find that you start to maybe try to read their body rhythms and stuff, but starting out that can be difficult. If you are using the music to help you with your pacing, you can also maybe have it help you with your rhythm.
And there's once in a while where you want something dysrhythmic, and that's going to be a little jarring. When we were looking at the method of Tepotment, we talked about and or with a shake, you can have a snap at the end of it. That's a little dysrhythmic, but mostly we want a rhythm that's similar to a rocking chair rhythm.
And that would be a case where a cohesive rhythm such as that will tend to be more relaxing in its outcome, versus something that is more jarring and discordant will have more of a activating
Yes.
effect. Now we're going to sequencing and transitioning.
Well, these all come
Kinda tied
into
together.
that. So
But this may be what part of their body do I start at, and where do I go from there?
So this is where a protocol comes in, and you don't want to be locked into a protocol. You got to be able to adapt, you know. So let's say you start prone.
Yep.
But if a client comes in and doesn't want to lay prone, then you got to be able to respond. But the more you have a practiced process of how you move around the body, and there's examples in the textbook, and when we do demonstrations, you know, when we don't have made-up clients, you'll see that. And the sequencing tends to be in each body area. Once you get that laid out, it is holding, getting the compression that we want, and then typically that will go into a glide, where we move at it from different angles, and then kneading. Those would be the ones that are used the most, with kneading used the least. And then moving from one part of the body to the other, you've got
like low back to thoracic spine, ribs.
You can
from
glide to
stacking.
that, but if I want to go from back to shoulder or shoulder to cervical, poor client here has a mask. Look at that.
Nice relaxation.
Yeah.
A little
yeah.
eye covering.
Today, well, we can, we have
Oh,
to
an
have
actual
a
mask. Yes.
Yeah, and then we can have some eye covering.
Yes.
You know, there we go. What were we talking about?
So sequencing and transitioning. So then it also becomes a part of, all right, so if I start in one body area and I need to get to another body area, how do I then get there effectively? And she had talked about with our just holding, that can be a way of just moving our way around. If I've worked on this side of the body and then I need to make it to the other one, I have to have basically a plotted out process of transitioning so that I am more smoothly able to get there in a timely manner.
You can do that with a pawing, like a cat would paw. I tend, of course, I always think I'm right, but I tend to use the holding with rocking.
Yes.
That's the one that I use the most. But it's a planned way of getting around the body efficiently.
And that's the hard part for people is all of this, when you're starting out, you have to be thinking about all these tiny pieces. The more you do it and you want to establish, at least early on, a pretty consistent protocol that you're utilizing again and again and again, so that it becomes routine. Then you can more effectively adapt out of that routine. But starting out, in order for you to effectively get your time management and pacing and even these transitional components smooth, so that you can do all of this within 15 minutes.
Right, and you want to get
keep
around
that routine and play with it and find what's most efficient.
And you want to get around the whole body with a general approach in about 40 minutes.
Yeah.
And then that leaves 10 minutes for your more precision type work, which would involve maybe some friction or something like that. And we also have to consider in these transitions the draping and the positioning that goes along with that.
Now we're on to frequency.
That frequency typically is how many times do you do something in an area?
Three is a standard, but it can be anything. It could be 3, 4, 2. How how many glides, how many needs, right?
And when you're figuring out your initial pacing and your sequencing, and think of threes: light, medium, and a little deeper. Three distinct pressure levels.
And she's saying thinking in terms of even the depth of tissue.
Yeah.
So light being maybe thinking more of the skin and superficial fascia, first layer muscle, second layer muscle, potentially further. Most people are comfortable if you have that second layer.
Yeah, and don't do too much. Come back to it.
Yeah.
I usually, if I can't get something to alter in a few seconds, it's not ready yet.
And that's a good point too. That work on an area, especially a focus area for a person, and the common one's going to be there's something, there's a symptom related to this issue. Working in the area for at the most, how many methods? Yeah. In terms of duration, a minute. Go work somewhere else and come back and reassess and see if the effect is optimal. But don't just keep on. Maybe the adaptive capacity isn't there. So that is an important point.
Some people they'll say, well, it's the spot, it's still there. I can still feel it. Well, if you work on it long enough and hard enough with too many times, it'll eventually go numb, and then it's damaged, and you're not going to get any result that way either.
And this cycles right into the other modifier, which is duration. So frequency and duration have to do with this.
Yep.
How many times
and how
frequency
long.
And how long. So you have to think in terms of those two modifiers. And then in the end, ultimately, our intention for outcome. No mindless rubbing. Everything with the right goal in mind.
Yep. We're either assessing or which is a full body general massage, moves all the joints, incorporates the holding, compression, gliding with some kneading.
And remember with that, the assessment can be just as much about confirming that things are okay.
Absolutely.
We are one of the only allied wellness healthcare practitioners that function in terms of keeping things that are functioning well. We're more about maintenance, and that idea of wellness maintenance is a huge part of our value. So the assessment can be, hey, this joint is moving well. That means that I have that assessment set for either a comparison to other parts of their body, or it can be in relation to a long-term treatment plan.
Yeah, a lot of people are looking for what's wrong, and we want you to look for what's right, and share that with the client. I'll go through my sequence, and I'll say, "Wow, that felt great."
Yeah, don't make them feel like they're just nothing but a pile of broken bricks, right?
Yeah. So good.
Beautiful. Well, there are our modifiers,
and that pretty much makes up the whole thing. Our intention goes right back to our goals, the 4, and the approaches to care, depending on where the adaptive capacity is. And let's not make it more complicated than it needs to be. But it does take a lot of practice. You got to do with this stuff. You cannot just do it once or understand it in your brain. You got to own it in your own your own kinetics, your own physical experience.